So the next cognitive domain is orientation. People are typically being referred to as being orientated to person, place, and time. So what exactly does this mean? So a person is orientated to time if they are aware of the day of the week, the month, the year, the season. They are orientated to what is happening with regards to time around them. A person is orientated to place if they are aware of where they currently are, the name of the supermarket where they are, or the hospital. Then we have orientation to person. Orientation to person refers to the ability of a person to know who they are and who the people around them are. So often orientation to person goes last. So in patients with neurocognitive disorders, or someone who has had a traumatic brain injury or a stroke, we may find that they lose their orientation, and the first one that goes is time. So you might find that the person doesn't know what the day of the week it is, what month it is, and they aren't orientated. Place is second. They might know that what town they're in, but they may not be orientated to the name of the hospital where they are at. So if you are noticing that sometimes a family member or someone close to you is not always aware of where they are or the day of the week or something like that, then it is really important that an occupational therapist is involved in assisting this person to become more orientated. An occupational therapist will use a variety of strategies, and family members can use a calendar to cross out the days of the month, and to really assist that person to be constantly reminded of what time it is, what day of the week it is, and just to have that very clear. So that is something that occupational therapists will typically assist people with, and it's often one of the first things that we start to notice when someone may have a mild cognitive impairment. Occupational therapists typically talk about something called executive function. Executive function governs the way we do our day-to-day tasks and it incorporates our ability to plan and organize our daily lives. So often someone with a mild cognitive impairment or dementia will typically have difficulty with executive function. And executive function is the highest level of functioning, and it draws on a lot of different aspects of cognition, such as abstract thinking, such as problem solving, such as planning, such as organizing. And typically occupational therapists can determine whether or not someone has problems with executive function. And if this is the case, they will often develop a treatment program for that person to either restore lost functioning. This is typical in someone who has had a stroke or who has had a traumatic brain injury. Otherwise, they assist with the development of these skills or maintain them if it cannot be restored. So occupational therapists play a very important role in identifying whether or not executive function is a problem or not. And executive function is typically something that an OT would look at to determine whether or not somebody is still safe to live on their own or not. If you found this series of videos informative, please like, share and subscribe to Therapy Zone and Up and Go Occupational Therapists on YouTube and Instagram. We will try and get back to you, so please post your questions in the comments below and let us know if there's anything else that you are struggling with at home or would like to know more about. Thank you.